Hello everyone, good day. My name is Glorian Grace Asistores. I am a student of Batch 10 Section A1. For this subject, I am going to present to you a teaching demonstration. So for today, I'm going to be giving a lecture with regards to the subject or the topic, the importance of personal hygiene. So today we are going to tackle a very interesting topic, and first and foremost, we have to ask ourselves, why is personal hygiene important? So before we answer that, we have a set of objectives here. First, we have to define what is personal hygiene, and then we will discuss the types of personal hygiene. After that, we're gonna cite personal hygiene for women and personal hygiene for men, just discussing the difference and the ways that women and men differ when it comes to personal hygiene. Next, we're going to review the ways to maintain good personal hygiene. And then we're gonna enumerate factors that can negatively impact hygiene. Then following from there, we're going to talk about the negative effects of poor personal hygiene. And lastly, we're going to be explaining the useful hygiene routine tips. So first, the question, what is really personal hygiene? So good personal hygiene, obviously, so this involves keeping all parts of the external body clean and healthy. So it is important for maintaining both physical and mental health. So when we are feeling good physically, our mental health also gets to be affected in a positive way. In people with poor personal hygiene, the body provides an ideal environment for germs to grow, leaving it vulnerable to infection. So in our world today, we can attest to this and we can observe this is happening in our environment, especially after COVID-19 pandemic. On a social level, people may avoid a person with poor personal hygiene, which may result in isolation and loneliness. So this is also one of the key facts as well. There are types of personal hygiene. So first type we're gonna discuss is the dental type. So I think this is also very common. Dental hygiene involves more than just having white teeth. A good dental hygiene routine can help prevent issues such as gum disease and cavities. It can also prevent bad breath. So this is also one of the facts, and obviously if we maintain our dental health properly, the good breath and also the diseases that comes from the bacteria around the mouth will not stay in the gums and in the mouth as well. So for the body, several million sweat glands cover the human body. So when bacteria break down sweat, the process creates a smell or body odor. So obviously when we're sweating a lot, so this is a waste product from our body. So the smell can be strong sometimes, especially if we are very dehydrated, or if we've just been playing, or we've been using a lot of energy in our bodies trying to compensate with the fluids and everything. So washing the body will help prevent skin irritation as well as removing the bacteria that cause body odor. So this is very important. So washing the hair removes oil and keep a person looking clean and fresh. So I think you know what I know what you're thinking. If you see someone with a very oily hair, you will be thinking that this person has not really bathed or showered for some time already. So this is also can be very evident when it comes to the washing of the hair, and generally the washing or cleaning of our body parts properly. Next is hand washing. So regular hand washing is one of the best ways to avoid spreading communicable disease. So this is very simple, but sometimes hand washing cannot be is not done as much as we want to do it, for example. But this is the very best way to avoid the spread of communicable disease. So the Centers for Disease Control and Prevention, also called the CDC, trusted source, recommend washing at certain times. So these are the times that they recommend for us to wash our hands before, during, and after preparing a food, before eating food, before and after looking after anyone who is vomiting or has diarrhea, before and after treating a cut or a wound, after going to the bathroom, after changing diapers or cleaning up a child who has used the toilet, after blowing the nose, coughing or sneezing, after touching garbage or dirty surfaces or objects, and lastly, after handling pets or pet-related items such as food. So these are just some of the times that the CDC advised or recommended for us to do hand washing, but obviously anytime is a good time to do hand washing. But we'll just make sure that our hands are kept moisturized. If we have like a hand lotion or moisturizer, prevents drying of our skin or hands also. So next we've got the nails. Fingernails may harbor dirt and germs, contributing to the spread of bacteria, especially if the nails are already long. Some of the debris or the bacteria or whatever can lodge inside under the nails. So also this is not very good. It is easier for dirt and germs, as I've mentioned, to collect under longer nails. So keeping them short can help reduce the risk of spreading infections. Next, so personal hygiene for women. So obviously the personal hygiene for women can differ when it comes to those of men. For example, here, the vagina is able to clean itself. No special care is needed because the normal flora and the normal pH is there, other than washing the external genitals. So for the ladies, please do not put anything like douches into the vagina, as delicate skin can be damaged. Here are some personal hygiene suggestions for women. So during menstruation, we have to just wash our body, including our genital area, the same way as we always do. Change tampons and sanitary napkins regularly, at least 4 to 5 times a day, or also depending if it's already full, we have to always change it. Always wash our hands before and after handling a tampon or a pad. So cystitis. Cystitis is an infection of the bladder. So this is a common cause condition for sexually active young women. Urinating after sexual intercourse can help to flush out any bacteria that may be in the urethra and bladder. So this is very important. Sometimes, ladies, we forget to do this, but please, I hope no one forgets to do this. Cleaning before and after sexual intercourse is very significant, and it's very important because this will help us avoid bacteria or any microorganism to lodge into our private area, which we don't want because it might cause more complications later on. Thrush. Some soaps and detergents can irritate the skin of the vagina and make thrush infections more likely. Some people find that they often get thrush when they use antibiotics. So just use mild soap and unperfumed toilet paper. Just gentle and unperfumed toilet paper. Avoid tight synthetic underwear. Try cotton underwear instead, and change regularly. There is medical treatment for thrush, so talk to your doctor or pharmacist if you experience this. Okay? So next, that's personal hygiene for women. We're gonna move on to the personal hygiene for men. So for men, for example, a buildup of secretions called smegma can form under the foreskin of the penis of the uncircumcised men. So if you are uncircumcised, gently pull back the foreskin when you have a shower and clean it properly with water. Not vigorously, but just clean it with water. You can use soap if you like, but make sure you rinse it well. So anything in our body, for example, the armpit that's covered, that's not easily surfaced or shown up, outside, we have to make sure that we clean it, and we don't forget to also rub it. Also here in for the women, because most of, obviously the women are, the hairs are long, make sure to also clean the back of the ears. Okay, so anything that's covered, the armpit. For men, smegma under the foreskin. So yeah, this is also a good way to maintain the personal hygiene. Okay, so next we have the dental hygiene. So for the dental hygiene, for a healthy mouth and smile, the American Dental Association (ADA) recommend brushing the teeth for 2 minutes at least twice a day. 2 minutes, once before breakfast and once before bed. Some people brush their teeth for 3 times a day. That's fine. 2 minutes twice a day is more than enough recommendation by the ADA. People should use an ADA accepted fluoride toothpaste and replace the toothbrush every 3 to 4 months. The ADA also advise people to floss daily. Make sure that we get everything in between the teeth that's not taken or that's not brushed properly by our toothbrush. Alright, so next is how to maintain good personal hygiene. These are the ways that we can maintain good personal hygiene, okay? Hand washing. This is very basic, the universal standard precaution. Hand washing. Nowadays, there's almost sink and soaps everywhere, and also running faucet, running water. Some people carry sanitizers with them, or wipes. So just making sure that, you know, every time we do something, obviously we wash our hands, especially if we're aware that what we just did was quite dirty, or even in the toilet, for example, anywhere. So yeah, hand washing. The CDC trusted source outlined 5 simple steps for effective hand washing. So first is wet our hands with clean running water, then turn off the tap and apply the soap. So some people put the soap first before turning on the faucet or wetting the hands. Please wet the hands first and then put on the soap. You can turn off the tap and then apply the soap. Lather the hands by rubbing them together with the soap. Remember to reach the back of the hands between fingers and under the nails. So just lather them together, and then remember that you have to also reach the back of your hands like that, and also in between the fingers. So like trying to interlace your hands like this. You can also do like that. And then after that, you have to scrub the hands for at least 20 seconds, which a person can time by humming happy birthday song twice. So this is like happy birthday song twice. You just rub your hands like this. Okay, we also do like that sometimes for the fingers and under the nails. Okay, so bearing in mind that your hands are wet and with soap at this time. And then you have to rub it for at least 20 seconds. This is the time we have to sing happy birthday twice, okay? And then the 4th step is to rinse the hands well under running water. Obviously, the faucet is running, the water is there. Rinse it properly, and then after that is dry the hands using clean towel, or air dry them if there's no towel available. So this is the hand washing. Okay. For the body, it is advisable to shower or bathe daily, using soap and water to rinse away dead skin cells, oil, and bacteria. People can pay special attention to areas that accumulate more sweat. So this is what I've mentioned earlier, such as the armpits, in between the toes, and the groin area. They should also wash their hair with shampoo at least once a week or more if necessary. Applying deodorant when fully dry can help prevent body odors. Okay, then we have for our nails. Using sanitized tools to trim the nails and keep them short is one of the best way to ensure that there's no dirt can collect underneath them. Scrubbing the underside of the nails with a nail brush can form part of a person's hand washing routine. Yeah, So sometimes nails can easily be forgotten or not paid much attention by people, but we have to also, make sure and to maintain that our nails are clean and also short to prevent it being sharp, and also for the germs, bacteria to accumulate under. So we will be discussing or talking about now the factors that negatively impact hygiene. So what are these factors that negatively impact personal hygiene? Poverty and lack of access to clean water can both have a detrimental effect on person's personal hygiene. So we can attest to this in, for example, if a community or if a household don't have access to water or to soaps, for example, then obviously the personal hygiene can be affected by the whole family or by the whole community. A person's mental health can also affect how they take care of themselves. So one of the obvious signs of a person that is going through some mental health issues is how they clothe themselves. For example, they present themselves in the public or with a person. And sometimes people who are living with certain conditions such as a psychotic disorder, severe depression, or drug or alcohol use disorder may find it very difficult to keep up with personal hygiene routine. So the mind and the body are all connected. So you can tell if a person is going through something mentally just by observing the looks. But I'm not saying all the time. Sometimes with psychotic disorder people, or if a person is experiencing severe depression. So that's when we come in, or healthcare professionals also come in to help and to support these kinds of people. This is the factors that can negatively impact hygiene. Next, negative effects of poor personal hygiene. So what are the effects of poor personal hygiene? Poor hygiene is a sensitive topic, and talking to a person about it can be difficult. So this is also very true. I had an experience like this when I was in college. I had a classmate, and the same situation. She basically, I don't want to say anything bad, but with regards or connecting to our subject today, our discussion, it's really hard to express the truth to someone who that will not take it really genuinely, or not take it good. It was hard, but it's not only us living or experiencing social interactions with people. So it's better to be self-aware so that no one can also tell us already what to do. So as a result, a person with poor personal hygiene could become isolated from other people. Poor personal hygiene may also have an effect on the workplace. So it's like a domino effect. If you have a poor personal hygiene, if someone has poor personal hygiene, everyone will notice it, everyone will talk about it. Unfortunately, these are the facts. So it's, as I said earlier, it's better to have self-awareness and to practice and maintain good personal hygiene so that we can avoid any other issues in the future. Companies may be more likely to offer jobs, trusted sources, and promotions to individuals who appear to take care of their health and presentation. So they say you are what you dress. Sometimes you are what you eat, but also it matters how you look like and how you present yourself to people, because this will give you a thumbs up or thumbs down. First impressions last, they say. Poor personal hygiene can be particularly problematic. Trusted source in the food industry. So there are also many health implications of having poor personal hygiene, with the CDC trusted source listing the following as hygiene-related diseases. So with poor personal hygiene comes microorganisms, bacteria, and germs, such as conditions that can lead to this are number 1, athlete's foot, body lice in the hair, chronic diarrhea. This comes sometimes from food poisoning. People will prepare the food without washing hands or sanitizing properly the place, and all of those. Basically, poor sanitation and personal hygiene too. Tooth decay, not brushing the teeth properly, head lice, body lice, the other one, hot tub rash, pinworms, public lice, KB, swimmer's ear, and ringworm. Okay? Hygiene routine tips. So we're going to talk about the routine tips. These are the tips for creating a hygiene routine, including just make it a habit. With daily practice, a new habit can become a regular part of life. Choose one area to focus on and practice until it becomes a second nature. The more you do it, the more that it just comes to you naturally and you don't even have to think about it. For example, brushing the teeth. So, as simple as brushing the teeth or hand washing every time we do something. Set reminders. Using the Notes app on a cell phone can be a great way to avoid forgetting any tasks. So this is also good way to remind ourselves. For example, if it's time for you to cut your nails or to change your toothbrush or to, for example, those routines, you can set reminders for that. Use rewards. A sticker chart can be brilliant incentives. This is for children to maintain their personal hygiene. Invest in nice toiletries. Using products that smell good may encourage some people to stick to their personal hygiene routine. It's just so nice to be able to smell good after, bathing or after cleaning ourselves, after stepping foot out from the bathroom, basically. Invest in nice toiletries. So those are the tips that can help us to maintain a good personal hygiene. So summary, keeping the body clean has positive effects on the person's social life and their physical and mental health. This just creates a good environment for everything to just flow in order. Personal hygiene is simply looking after the body and keeping it clean and healthy. Developing and maintaining a personal hygiene routine is key to having a healthy mind and a healthy body. The golden rules: be kind to your body, practice proper hygiene, stay safe and healthy. Thank you everyone for listening and for being with me today. I hope you had learned something. If you have any questions, you are free to ask me anything, reach out to me, and I hope this video or this lecture is fruitful and had given you some insights today. Once again, thank you, and I hope you have a good day.
Thank you for watching my lecture. I hope you can give me a favorable feedback by filling out this evaluation form.